the trematodes. The trematodes have different features. They're actually like two groups. They have the ones like fasciola hepatica, which is a liver fluke. This one you find that they tend not to have a separate adult male and a separate adult female. Whereas another group of trematodes, which are the schistosomes, you find that they have adults that have a male adult and a female adult. Yes, Chief.
Madam, I don't know if it's just me, but I can't see the slides.
I haven't started with the slides yet. I'm still giving the So I'm trying to say that when we talk about trematodes, you have the blood flukes, which are the schistosomes, which will have different general characteristics. Remember, if we talk about the general characteristics of a cestode, you find that they only have one adult. They don't, which is male and female. I mean, they don't have a separate male adult and a separate female adult. Those are the cestodes, the tapeworm. Whereas in the nematodes, you find that they had the adult male and the adult female. So I was trying to explain that when it comes to trematodes, there are two types. There are the blood flukes and the lung flukes, which will not have adult, which with different sexes, and they will tend to be leaf-like. When it comes to schistosomes, which are also trematodes, you find that they actually have an adult male, adult female, and they have the eggs. So I'll go on now to share the PowerPoint. Are we able to see the PowerPoint?
Yes,
Yes,
madam.
Okay. So schistosomes, what are the lecture objectives? We should remember that we should be able to know at least the general characteristics of a trematodes. Then all the schistosomes, the genus name is Schistosoma. Okay, Schistosoma. That's the generic name. Okay. Then of this Schistosoma, you have many species. There are about 6 species, but we're only going to deal with 4. Hematobium, Mansoni, Japonicum, and Intercalatum. Of these, we should be able to know the mode of transmission, which system each one of them affects, the main symptoms, at least 2 of each one of them, prevention and control, laboratory diagnosis. That is, what are we supposed to know about the laboratory? Can you mute the mic? Hello? Can everyone mute their mics? So laboratory diagnosis, know which specimen you use, for instance, to make a diagnosis of hematobium, which specimen will have to use to make a diagnosis of Japonica. So, you know, that's actually very little to know. Knowledge that they are trematodes. So what are the general characteristics? I think I went through generally, but trematodes, you generally have a gut, usually not complete. They can be flat-leafed, like if you're talking about the liver flukes, like fasciola hepatica, or the lung flukes. Whereas the blood flukes, in which schistosomes fall in, are parasites that will have adults, a male and a female adult. And they have suckers as one of their features, oral and ventral suckers. So we said there are 4 species we're dealing with. So of these 4 species, they can be divided into 2, depending on the main symptom they affect. So there are those that are intestinal schistosomes, okay? And they have the urinary. The intestinal schistosomes comprises of the three. We are learning, of the four we are learning, three of them are considered intestinal. You have Mansoni, you have Japonicum, and you have intercalatum. Lastly, you have hematobium, okay? Hematobium is a urinary schistosome. Schistosome is a urinary one, meaning it mainly affects the urinary system. So when you talk about what systems do they mainly affect, Japonicum, Mansoni, and intercalatum affect mostly the intestinal system, whereas hematobium affects the urinary. Talking about hematobium, I'm sure all of us during primary school, some stage of our secondary or primary school, we learned of bilharzia, okay? Mostly that bilharzia we learned of was mainly the hematobium, where people were said to be passing blood in urine. That was hematobium. What more can I say about this? So you will wonder, of these parasites, which ones are found in Zambia? In Zambia, we have Mansoni and we have hematobium. Mansoni is found. What you notice about these two parasites that are found in Zambia, you find that they are not found in the same location. For instance, here in Lusaka, you find that there's hematobium in Ngombe. Ngombe is near Roma Township. It's a residential township. In Lusaka, Ngombe area, that's near Roma. Whereas you find that you have Mansoni in Kafue. So one would wonder, why is there Mansoni in Kafue and hematobium in Ngombe? First, they are found where there's fresh water. So there's a stream in Ngombe, and then in that stream, there must be that particular snail, which is the intermediate host. Each one of these species of schistosomes have a particular snail that they use at the host. If that snail is not there, that particular species cannot be found in that fresh water. Okay, so there must be a kind of snail that is found in Ngombe that is favorable for hematobium, and then the other types may be found in the Kafue area that is favorable for Mansoni. So we start with Schistosoma mansoni. Some of you might be thinking, what about Japonicum? What about intercalatum? You find that Japonicum, from the name, must have been related to Japan. Yeah, found in Japan. But you know, with the Japanese, they've already eradicated it. But it's still, Japonicum is still found in other parts of Asia. So back to schistosome. So we start with Schistosoma mansoni. It has adult worms. Those are the morphological forms. It has adults and female. The adult male is a very responsible male. He has got a canal in which the female schistosome lives. They live together. They live in pairs, okay? So mansoni, this is the male mansoni, the bigger one. He has a canal in which the female lives. He provides accommodation, yeah. So this is the female. She's actually longer than him, but that doesn't discourage him. So she's longer, she's taller. So she actually doesn't fit in well in the canal. So you can see this, her part of her is sticking out. She's slender. And this is also part of her. This other part is the male. Interesting, huh? Mm-hmm. So this is the same. This is the male. These are the oral and ventral suckers, okay? This is the female, the slender one. This canal is also known as gynecophoric canal. What is the other morphological form? So we've seen that schistosomes exist in the form of adults, male and female. They also exist as eggs. The eggs of schistosomes are a very important feature. Why? Because through the eggs, the species of schistosome affecting or infecting that patient is able to be established, because each of the species has a specific feature. For Hematobia, Mansoni, which we are dealing with, it has a lateral spine. You see this thing, the egg is not just oval or whatever. It has what is known as a spine. So a lateral spine, eggs with lateral spine, seen in the specimen, will be able to help the identification of the species. So you remember that it's not all eggs that help identify the different species. If you remember, if you have learned hookworm, when you talk about hookworms, the eggs of hookworms are identical. Through looking at the eggs, the scientist or the lab tech cannot say this is Necata americanus or Ankylostoma duodenale, because the eggs are identical in hookworms. They will only report them as hookworm eggs. In the same vein, if you talk about the eggs of tapeworms, Tinea solea, Tinea cyclinata, you find that the scientists again cannot identify which species of Tinea it is, which tapeworm. They will only say Tinea eggs. Okay, but in the case of schistosomes, there is easily identify the species from the eggs. So lateral spine eggs. So when you talk about these eggs actually expelled mature, and they're said to be mature because they carry inside them what is known as a miracidium. So if you remember in the lecture outline, you don't really have to know able to be examined like us to draw or the life cycle of schistosomes, but we have to go through it for you to understand. So the eggs, what will happen is the male and female will mate, and the female will start to lay eggs. These eggs are passed out through the system they affect. In this case, Mansoni is said to be an intestinal schistosome. They affect the intestine. They actually are in the venues of the port of Venus, so they have easy access to to releasing their eggs into the intestine. So these eggs of Mansoni, they are passed out through the feces, since they're intestinal schistosomes. So what will happen is that when these eggs have contact with fresh water, the mere contact with fresh water will cause the egg to break and release what is inside it, the miracidium. So once the eggs have contact with fresh water, the miracidium is released. The miracidium now will start to swim around in the water to look for the snail. Okay, the intermediate host is a snail. Like I said, there are many species of Mansoni, of snails, that each species of schistosome uses to continue its life cycle. Okay, we don't have to know the different species. We leave that for the people who are studying environmental health. So the miracidium will invade the intermediate host, the appropriate snail, and the life cycle will continue in the snail, which will result in the miracidium transforming into what is known as cercaria. The cercaria now will be released. The cercaria has a tail, and it will be swimming in the water looking for a human host. Okay, How is it transmitted? Through the skin. So through the skin, it will penetrate into a human host. So mode of transmission that you're supposed to know. So transmission of schistosome, schistosomiasis, you say that the cercaria is the infective stage which will penetrate the skin. Once the cercaria enters the skin, it will drop its tail, okay, and turn into what is known as schistosome. And this schistosome will migrate to the small venules, okay? The immature worm will travel, since enters the skin, it will access the venous system. Through the venous system, it will reach the heart, it will reach the lungs. This is part of your physiology, and enter the portal system. So in the portal vessels, that's where it will mature into portal system, into adults. That's the portal system of the liver. So the worms will pair and will mate and will migrate to the venues of the intestine where they deposit the eggs. Remember, these are blood flukes. So mode of transmission through the skin, infective stage, cercaria. Okay. Where would they live? In the venues of the intestine. That's why they're known as intestinal flukes or blood flukes. That's schistosome, intercalatum, and japonicum. Generally, everything is the same amongst these three species. The only difference is the shape of their egg, which helps to identify them. And the different species will be found in different regions. Intercalatum is found, I think, also in some parts of Africa, maybe Congo or so. Okay. But intercalatum we don't have in Zambia. So generally, this is the simple life cycle which you can go through just to get a clear understanding on how transmission occurs. But, and you can see there's someone who has adult male and female as a host, as an infection. The eggs will be passed through the feces. You can see a lateral spined egg. Once the eggs have contact with fresh water, since they are laid mature, they already have the miracidium. The miracidium will be released, which will start swimming in the water to find a snail, the appropriate snail. And this snail, in the snail, the life cycle will further develop into a cercaria. The cercaria will be released, which will penetrate skin. The skin does not have to be broken, okay? It has some enzyme that facilitates its entrance. And through the venous system, it will go to the heart, lungs, to the portal system, and into the venues of the intestine, where they'll start to lay eggs. So I think that's pretty simple. Okay. This is just another. So how does disease happen in schistosomes? I'm just mentioning it to help understand the clinical features, although pathogenesis is not a requirement in the lecture outline. So how does disease happen? Mostly disease and tissue destruction that occurs in schistosomiasis, that is associated with schistosomiasis, is due to the eggs. The eggs that are produced will cause the immune system to react to the presence of the eggs. It's not even actually adult worms. The eggs are the main factors. So the more eggs that are produced, the more damage. So these eggs, the immune system will react to them, and it will cause inflammation and eventually fibrosis of that organ where the eggs are deposited. You find that they're deposited in the intestinal mucosa. You find there'll be fibrosis if it's an intestinal schistosome like intercalatum, japonicum, and mansonite. there will be fibrosis at the level of the intestine, okay? And then you find that these eggs can be sequestered to other parts of the body. You find that for Mansonine, there's a tendency that they can be taken to the brain. With others like Hematobium or Japonicum, they can go to the spine. And you find that wherever they are taken, there will be inflammation and fibrosis there. So if the patient is unfortunate enough to have the eggs sequestered, taken to other bodies, other organs, you find that they might have more severe manifestation. But the most common modes of manifestation is the intestinal for intercalatum, Japonicum, and Mansonine, which will result in bloody diarrhea, dysentery with blood in the mucosa. And in the stool, if it's Mansonine, they'll find lateral spined eggs. Apart from that, since there's allergic reaction, the level where the Cercaria entered, there could be an urticaria rash, okay, due to the presence of the infection. When you have infection, the body reacts, and usually the main symptoms as the infection is being fought is fever, okay? And fever can result in weakness. Some people there's been talk of weight loss and abdominal tenderness. All this with time, we find it could be all these kind of manifestation. Then a long-term manifestation is where you find the intestinal wall is inflamed, there's fibrosis, thickening, there could even be abscesses at the level of the intestine. So what are the main symptoms one should be able to mention when you talk about Mansonine? Is bloody diarrhea. You can add anything else, but bloody diarrhea is #1 symptom. So how do you make a diagnosis of Schistosoma Mansonine? Characteristically, the report of a stool specimen. What's the specimen you use is stool. What are you going to find? A lateral spined egg. Many kinds of tests can be used. Wet prep, where you just add saline, wet the stool and look under a microscope, or you can use a concentration method like CAT or CAS, okay? So that is diagnosis. That's the main diagnosis. These others are irrelevant. Just to give you a wider picture, since the eggs can lodge in the lungs, you find that eggs can also be found in sputum. But this is when the infection has spread to the lungs. That means in that kind of to show that there's infection, the lungs have been affected. Drug of choice, praziquantel, is the drug of choice. Like I said in the topics I taught you, there is no need to talk about the dosage as at now. But praziquantel, which is just for general knowledge, a single dose treatment is a drug of choice, praziquantel. So we have Japonicum, is the other species. Transmission is the same as Mansonine. Everything else is similar to Mansonine since they're both intestinal schistosomes. Okay, the only difference is Japonicum, this manifestation will be more severe. Try and remember this point. It produces more eggs. Okay, so you can find, whereas how do you differentiate Japonicum from Schistosoma Mansonine, which is also found in the stool? The eggs of Japonicum tend to be round, and they have a small process, a small spinous process, okay? Okay, so that is the main difference between Japonicum and Mansonine that is found in the stool. Otherwise, all the other things, how disease occur, the symptoms are all the same. Schistosome intercalatum, another intestinal schistosome. Like I mentioned, yeah, it's found in Congo, Gabon, and such places. It is an intestinal parasite. The egg, which is the important part, has a terminal spine, So lots of eggs found in the stool specimen in countries like Congo who confirm that it is intercalatum. So we go to hematobia. Schistosome. It also has adult and female, which also live together. All the species, the male and female, live in pairs, okay? They have eggs and terminal spine. You can see this is the egg, this is the terminal spine. Then you'll be saying, but wait a minute, just now we learned that intercalatum also has a terminal spine. Yes. One, how will you know this is intercalatum and not hematobian? One, intercalatum will be found eggs mostly in stool, whereas hematobian, being a urinary schistosome, the eggs will be in urine. Contamination can occur, but contamination will mean that there will just be very few. You can see that the eggs are more in the urine than in the stool. And also the fact that, for instance, in Zambia, what we have is hematobium and not intercalatum. So the life cycle mode of transmission will be the same through the skin. How will the eggs be passed out? They'll be passed out in urine. So someone urinating in the environment will put others at risk to getting hematobium, schistosomiasis, or urinary bilharzia, as it's commonly known. So once the egg has contact with fresh water, the miracidium will be released, which will find the right kind of snail has to be there. And the miracidium will develop into a cercaria. The cercaria will be released to enter the skin, and eventually the infection is established. What did I want to say? So the worms will migrate from the liver to the veins surrounding the bladder and adjacent organs. So you can see now what determines whether one parasite is urinary or intestinal is where the adult worms will go and establish themselves. So in the case of Mansonine, intercalatum, and japonica, we saw that they stayed in the venues of the intestine, whereas the adults of hematobium will go away from the liver to the veins surrounding the bladder and adjacent organs. So that's how they affect the urinary system. So the symptoms are related to the urinary system. How disease occurs is the same. The eggs lodging in the blood, in the venues, in the bladder, will cause fibrosis at the liver of the bladder. They'll cause inflammation, and that is resulting in the urine, blood in the urine. So the main symptoms of hematobium is blood in the urine. Eventually, there will be malignant growth of the posterior wall of the bladder, known as sandy patches. Can happen. So the main symptom of hematobium will be blood in urine, okay? So these eggs can lodge in many organs, and you find that for hematobium, it has lodged in the cervix of most women. You find that a woman, they'll be thinking maybe she has a cancer of the cervix, and yet the patient actually has, when they do a biopsy, they find that they actually have hematobium infection. So diagnosis is terminal spine eggs, the urine. So there will be spinal spined eggs in the urine. And if they are found in the feces, they shouldn't be strained. Sometimes there can be contamination since these two places, two organs are neighbors. Drug of choice is praziquantel. Okay. So prevention and control. When you talk about prevention and control, you think of how disease occurs. So if people are not stepping in fresh water, you find that that can be a mode of prevention. But you find people who actually go to fresh water is because they have no other source of water. They have to collect water in the stream, in the river, they have to bath there. So stopping them from going there will not be a good prevention control method. You can talk about snail control rather. You can introduce a biological control method where you can produce a fish that eats up snails that will reduce the number of snails or eradicates. It can also be chemical control of the snails, as long as that chemical will not affect the quality or endanger the people who are drinking water. So the chemical being employed should, like for people in environmental health who have to deal with that, public health control, you find that you can do snail control either biologically or chemical as a prevention control method. You should know this. Sanitary improvement of the environment. If people are using the toilet, pit latrines, are not defecating in the environment, it's another method of prevention control. Health education on sanitary habits, and also improving levels by providing toilets for people. Treating every person who has schistosome is another effective way of controlling prevention schistosomiasis. So this is the last slide. Let me come the last 5 minutes, and so we can have a discussion. So that is schistosome. Any questions, comments? Moses, is your hand up?
Yes, it is, madam. I have a question.
Okay.
I want to find out whether a Sicaria is visible to the naked eye.
Whether Sicaria is visible to the naked eye, no. It's not something that are visible, no. So that you can keep away, or because I think if it was very visible, maybe there'll be a method of trying to see that, oh, this water is Sicaria, and people might keep away, but it is not visible. That's why even the entrance doesn't leave a big hole that you can see that, something entered from here. It's so small, what rather you see there'll be a rash there due to the allergic reaction responding to the entrance. Yeah, Sicaria is not visible. Okay.
Thank you.
So you can see that schistosome is pretty simple. Just read up the notes. First, just read everything. Then later you use the lecture outline to know exactly what you should know. Any other comments, questions? We have about 4 minutes. Okay, Chilufia. Henry.
Madam, just asking for the the slides with audio, the one you've been recording for all the topics.
Why? Will you have time to listen to them?
Yes.
I hope so. Okay, I'll see for all the topics I've given you.
Yes.
Okay. Okay, as I give you slides with audio, sometimes they are more extensive than what you need to know. So as you listen, then try and zero in to the fact that try and determine what you should know and what you shouldn't know for the exam, what you should concentrate in reading. But I'll send them through your different class reps. Yeah. Chiengo.
Madam, when we first
Yes.
met, you had mentioned that you were going to do HIV and AIDS with us. So since this is our last lecture with you, you're not doing HIV and AIDS with us?
Did I say that?
Yes.
HIV and AIDS in terms of what? Virology? No, I don't teach virology. So I don't know how, maybe I was caught in the wrong context. HIV and AIDS should be taught by whoever is teaching virology. Okay, so for instance, I might have topics like where they will name it HIV-related schistosomes, just to talk about immunity. But I don't teach HIV, no. Otherwise, if you have any doubt, you can ask Dr. Mate. I think she's the one coordinating this program. Chiengo, quickly, we have 1 minute, 30 seconds.
I have a question.
You are breaking, I can't hear. Come again. Breaking seriously. Who heard him, her or him? I didn't hear. Can you quickly type? We have 1 minute. If someone heard, just say what he said. Chiengo, send me a WhatsApp. Tell the class rep to send the WhatsApp, then maybe I can send the answer. I didn't hear a word and will be cut off less soon. Who heard Chiengo? I haven't heard, sorry. Send the message, I'm sorry. So